So what is your take on this?
Of course, yeah, I'm a proud Odia. I do not want to demoralize anyone, but to be very upfront, I feel little low when it comes to Odia startup culture. I'm not though very intact with it, but yes, so I have some friends who started this. Maybe I had been to OHub. I have met a lot of people maybe a couple of years back. He was the ex-director of Microsoft. He and me, we had visited Odisha.
Oh.
So we have gotten an opportunity to meet a lot of entrepreneurs.
जगन्नाथ महाप्रभु का हाथ, माँ का आशीर्वाद और मेरे स्टूडेंट्स और चाहने वालों का दुआ है मेरे साथ। नमस्कार, मेरा नाम है अरविंद दास और आज फिर से आपका दिन बनने वाला है बहुत खास। हेलो एवरीवन, माय नेम इज अरविंद दास, founder of Lifecraft Training Academy Private Limited and host of this show that is the Corporate Brahmastra podcast series 2.0. So today we have someone very special as in he has been a brother to me since our ITR BTech days, and since then we have been brothers, and you will see in this video that what kind of inspiring personality he is. In fact, he was not like this when he was a BTech student. In fact, I was also not like this, the way you are seeing right now. And things have changed for me, and things have also drastically and tremendously changed for him as well.
Yeah.
So put your hands together to welcome our today's guest, Mr. Sambit Bishwal, who is the founder of RSB Healthcare and also the director of RSB MedTech. So Sambit, welcome.
Welcome. Thank you. Thank you very much.
Sambit, to our show.
Thank you very much. It's a pleasure meeting you and been in this platform. I think we are planning this from a long time.
Yes.
But finally I got this opportunity. Yeah.
Thanks to you.
Glad to be here.
Thanks for accepting my invitation, and that too.
It's my pleasure.
In a short notice, you made your time.
Yeah.
So really means.
Same here.
Thank you, Sambit. So first, we would love to know about your journey, like from a BTech student, and then you were into corporate space for a long period of time, and then you moved on to this entrepreneurial segment. So how has been this transformational journey for you?
In short, it has been a challenging journey. It was not never easy. So if I will go back, like you said, my engineering, and I was clueless what to do after my graduation. So I had no idea about the market out there. Maybe this was a path that picked me. So I got into the US healthcare segment when, like in India, there was not much of the noise about this. So I started my journey with Snapdeal. Like I was one of the maybe first batch trained people from Salesforce, and then I took a diversion. Then I left the tech side. I went into the management side of the US healthcare. So my forte been mostly into the diagnostic side of the thing. So it was very interesting because initially I thought of getting into the MBBS side of the thing. I couldn't do that, and then when I got this opportunity, I could connect the dots, and then it gave me a comfort or a peace of mind when I thought I'm doing something into healthcare. I can maybe transform some of the aspect of healthcare that was not there, because when I did a comparison between the US healthcare segment and Indian healthcare, we are still trying to do a lot of things where the structure is already in place when it comes to US healthcare. Then I kept moving. I did a lot of you can say I took a lot of risk. Right, so maybe I was one of a candidate in Bangalore where the HR called me as a weirdo because I switched the job. It's not because of the salary. On the negotiation, I used to ask my HR, like, you drop my package but give me one slab up, because I wanted to learn the business. And
so learning was your major priority.
Yes, so I got a pretty good learning curve, and that gave me the exposure to the market. And meanwhile, I became kind of a critical employee who can understand the business of healthcare, who can maybe understand the scientific side, and then I worked as a bridge between the tech and the healthcare operations. So that made me a little stronger, and then I started working on the people management side of the thing. I moved into the executive position, right? So I have shared office with a lot of ex-governors of US. some mayors of US. I was into a lot of US companies out there, and then I have catered almost a lot of big labs. So maybe if you ask me, by now in INR we have collected more than 22,000 crore
Wonderful.
across US for my clients. So and that time when I became the first director to a US company, I think I was 28, 29.
That's
So
it.
I can tell like this journey was never about experience. It was about exploring new things, adapting the technology. Initially, when we saw there are a lot of processes that in healthcare are paper oriented. These are manually driven. So we were trying to automate this process with the RPA, doing a lot of web scraping and things like that. And then with the AI, so we are not, maybe we are not the pioneer, but we were among of the fast few who have given this approach. And right now, as we speak, we are both a service and product based company. So I am the founder and president of a US LLC.
Okay.
So we are a delivery LLC, and we have a delivery unit here in India. So by number, maybe we are 60 plus now. Most of my segments are, my software guys are from a data science background. We have few FDA approved products. We have one product goes as examinemyhealth.com. Then another one is INS Crow, where we have automated the US healthcare processes up to 80-85%, and we are still working to enhance those productivity. So, and again, like we are working on a global healthcare product. This goes at chikicha.com. Chikicha is our domain.
Okay.
So where we are almost working on 75,000 medical diagnoses. So the aim is to make sure that the patient is being diagnosed properly, so that they can avoid the complications that comes in a later phase. Or we want to streamline that processes. My point of view is a physician or a doctor should focus on the emergency care treatment, or actually treating the patient, not to discuss with them to understand, because we can feed those information to our bots. They can interact with the patient, and they
AI
can
bots are you talking?
Yes. So we are sitting on nearly more than 2,500 API endpoints with one of my product. That is a big thing. Then our OCR model claims to be 98% accurate, which almost digitalize all the paper format of the hospitals and even the labs. And the bigger zone of my business is into NGS, that is, can say, genomic sequencing. So that's the high level of the scientific thing. Let's suppose it is cardio, it is immunodeficiency, neurocognitive, or you can say pharmacogenomics, cancer. So we do the genetic analysis to understand what is going on with the patient, whether they had a family history, and if the gene is changing or it is getting updated. So how we can do the lifestyle or the drug management to maybe reduce that risk factor.
So can I say that it is a kind of kundli, a patient's kundli?
Yeah, you can say.
Horoscope.
You can say it's a patient kundli, but it's beyond that.
Beyond that.
So this is a very high level science. So my usual days goes in and around with lab scientist. Like you can say that we do a lot of validations, a lot of lab developed tests, and even on the radiology side, my tech team has gotten nearly 5 FDA approved products. Right, so a few of our bots can interpret the result of CT, MRI.
So basically, what I've understood is that it is an amalgamation of tech and healthcare.
Yes. So that's what we called ourselves as a health tech firm.
Wonderful.
Yeah, so this is what we do. And so the journey, to answer your question, it has been fantastic so far, but still we are keeping low because a lot of our bigger products are still in the beta stage. We are developing it, and we are trying to do a lot of testing before we put that into market. But yeah, we are going to make some good noise pretty soon.
Wonderful. All the very best, Sambit.
Thank you very much.
Now my second question is that I keep following you on LinkedIn and other platforms, and I have observed one thing, that you keep hiring a lot of candidates to expand your team, to expand your business.
Right.
So basically, Sambit, what kind of candidates you look for normally, and what are the competencies you expect from a candidate?
Right. See, like I said, we are into a complete industry. Like we cater a lot of stops in the healthcare. When I said the healthcare operations, it goes starting from a doctor's license to help them getting the to do the marketing, to do a market analysis, then their accounting, bookkeeping, and then the strategic part of the thing. Then I am connected to a lot of manufacturers across globe, right?
Okay.
So we are into the, you can say we can supply starting from reagents to MRI machines. That is a separate segment we deal with. So that being said, whatever I have covered, and then let's suppose medical coding is a part, and the data science and the,
So majorly you hire engineers.
we had a large scale of people, right? So I can hire a chartered accountant.
Okay.
I can hire kind of software engineers. Big set of people are there. Then when we talk about software engineers, we are strong in the Python. Like our backend is coded by the Python and the front end is in React.
Okay.
So that is most. And then of course, few of my products are in the market. So production support, those hiring are also there.
And you hire people like freshers, do you hire, or experience for this tech part? Python.
Yes, so we prefer going with freshers.
Okay.
Freshers in the sense may not be exact zero.
Why do you prefer freshers or young chaps?
Because I'll tell you, my management or my leadership, whoever, like my CTO is a young guy, my CCO is a young guy. So we are very aggressive management.
Okay.
And we adapt the technology which is today.
Okay.
Right? So if tomorrow there is a technology coming in and we feel like today is getting outdated, we immediately scrap it and go there. Okay. So let's suppose few of the AI tools that were that came in April 28th, May 1st, we were the first company putting that live into our environment.
Okay.
Because we do not take time to make decisions when we see that. So our like the technology we use are pretty cutting edge. So if you look at the legacy hiring system in India, they are already there. So it is something coming in new. So they, of course, they do not know it.
Okay.
So when my senior management or my tech side of the people, they are ready to train them. Doesn't matter like whether you have 10 years experience into SAP, and right now we are building AI bots. So why should I have that person? Yeah, of course there will be some approach that matters. That's why we are there to train.
Provided the person should be updated.
Yes, the person has to. We take a 30 minutes of the interview, technical interview round.
Okay.
So in the interview, what usually we ask, irrespective of what is your answer coming, we look at the approaches. We need brainers to go there. We just don't need coders, because with the like ChatGPTs and other AI tools available, they can just give a prompt. But you should know how to give a prompt.
Okay. That's wonderful.
So that's how. But it is a mills. Sometime like right now we have to go and demo. We do have product owners, project managers. So those people has to be there to mentor. But if you'll ask the ground level staff, we need them to work. We go with fresher. 0 to 3 years of experience.
Well, that's very good news for freshers who are watching our video. And Sambit, can you also tell that how these youngsters can apply in case they're interested for these kind of
we run the internship batches, right? So we maybe screen a lot of people. We take the best of them for internship. And personally, from my side, I do not believe in 30 minutes to 1 hour of interview. So we keep them in our ecosystem for a month or two, and we see whether they are exact fit for my organization or not. If they are, then we confirm them. So we welcome people like if they have the strong Python knowledge, and because randomly if I keep people, the problem is they cannot adapt the aggressive atmosphere.
Yes.
So if they are up for innovation, because all the products that we have, these are innovative products that is not in there. So like you asked me what are Jones. So I can hire a life science graduate.
Okay.
I can hire an accountant. I can hire software engineers. I have an army of lawyers with me.
Okay.
Because these products are, we are claiming around maybe.
So full-time corporate lawyers also you have?
Yes, we have it.
Okay.
I have 13 lawyers. Few of them are high-level counselors. Few of them are like you can say in-house counselors or attorneys in India, because we are going for the intellectual property registration. So and we already have 4 products in market.
Okay.
There are a lot of tasks. So it is all Joan thing, right? So if there is a guy from MBA, we cater the marketing side of the thing.
Marketing side.
And then the HR. So this all part plays it. Like
wonderful, Sambit. Also, we would love to know that what is the scope of these candidates in your company and in this particular healthcare sector?
See, healthcare is a sector when, let's suppose we had been hit by this pandemic, so all the sector crashed.
Yes.
And that time we made crazy money, right? Like healthcare made crazy money because it is about your health, and that's where we are scared of. So this is a industry. It will never crash. It will stand till the human race is there.
Yes.
So that being said, the scopes are pretty high, and like I said, there is I will quote unquote this. There is a hospital in China with 40 AI doctors and 5 AI nurses. They have catered 10,000 cases. There is not one human on that hospital.
Okay.
So the health tech has gone there. We are not there yet.
Okay.
Right? Not even in US and India. I'm not sure.
So China is way ahead.
They try again the like quality and how sustainable their product, that will matter. But
number wise, I think they are ahead.
yes, no, of course. But I'll tell you the due diligence that we do in US and the kind of government aids and funds that they get in US, that is pretty bigger than any other countries standalone. So that's why the scope is bigger there in US.
Okay.
So they do concrete things. They have to be genuine and authentic what they are doing, because we are under HIPAA, we are under FDA. There are a lot of compliances that come in place, so that we have to be concrete. So yeah.
Sambit, you have been in Bangalore, I think, just after passing out from
almost
ITL,
12,
right?
13.
Okay. It's been 13 years. It's a long journey, long time at Bangalore. So tell me, what difference do you feel it's there between the Bangalore startup market and Bhubaneswar startup market, and how people of Bhubaneswar, people of Odisha, they can put best efforts so that we also can be as good as the Bangalore market. So what is your take on this? What is your suggestion?
Of course, I'm a proud Odia. I do not want to demoralize anyone. But if you ask me, to be very upfront, I feel little low when it comes to Odia startup culture.
Okay.
I'm not though very intact with it, but yes. So I have some friends who started this. Maybe I had been to OHub.
Okay.
I have met a lot of people. Maybe a couple of years back, I came with.
So you were in touch with the Odisha startup?
Yeah, one time, one of my ex client, he was the ex director Microsoft. He and me, we had visited Odisha.
Oh.
So we have gotten an opportunity to meet a lot of entrepreneurs, and a few of them are doing pretty well. I think there was a DriveView or some company, they are doing pretty well. I see them going to Bangalore also. They have.
Let's Drive.
Let's Drive. Yes.
He was a senior.
I got to know that. Yeah,
Mr. Ankur Patel.
Yeah. So and then maybe another company was Be Cure, and they are also like
they're doing well.
Yeah. A young dynamic team. They are trying to solve some purposes, getting into tier 2, tier 3 or remote areas. They're trying to have the telehealth accessible. So we have certain good people who are trying to make some difference. But the problem is sometimes there are other companies, I will not name few of them, but I understand that people get some idea and they chase behind money. They look for the VCs, they want the HNI money, this, that. So whenever I try to mentor them, so I'm a healthcare consultant, I'm a high-paid consultant in US. But when it comes to our Odia ecosystem, the problem is it's not about their idea. They do not feel the brand. Moreover, they try to get the funds and they do not have any data supporting to what they claim to make.
Okay.
So we are an analytic company because we deal with a lot of data. So I suggest my fellow mates that you first gather the data, do the risk analysis, and then if you think it's a good to go for it. If not, hold, rethink, revisit your proposals, just preparing a deck. And right now that is also with AI is not a big thing. So just go what I see here that is maybe you can defer to this statement. And I apologize if it is not the fact, because I have not met with a lot of people, and few of them are doing pretty well too. Maybe they have their thing. But when I started,
whatever sample size survey you have done, as per that,
yes,
you are sharing.
That's what I'm sharing. Like mostly we get an idea. We don't know whether the market. We do not have any gap analysis. We do not know whether the market needs it or not. One of my mentor, he's a world tech leader. He told me once, like, Sam, if my name is Sambit. I go by Sam in my professional areas. So he told, like, Sam, there is two ways. Like so, in this place, I will ask you to create what is a problem. I can ask somebody else to pick a problem, or I pick a problem. The three problems will be different. The person who picked you can say the worst problem, right? He did the gap analysis. That person is the bigger consultant. Because once you get the problem, anybody can drive a solution. That becomes a GD. And who talks best, he can crack it.
True.
But the problem is, are you picking the right problem statement or not? That's the question. People going to IIM carrying that NQ that we are in IIM, we have been mentored by a lot of people who have a lot of network with VCs. But what you are trying to do, you are trying to getting into the clothing segment, or you are getting into the nutrition segment, when it is there, like you are going to just get into the rat race. This is again my personal opinion.
Okay.
But yeah, that's what I strongly feel. But when it comes to Bangalore, again, Bangalore maybe even if somebody is making a cloud kitchen and running it successfully, they're bigger than any startup that are running there. Because what is your book that says? If somebody, it's not like before that people had money, they were putting in money, they were not asking you accountability. But right now, the VCs have also stopped funding. If you need money, why do you need money? You should know why you need money.
So you should be clear first.
Your vision should be clear, like what you are chasing, what is the complete market that you are targeting, how much can you disrupt, but what is that evidence you have that your MVP can crack this. So unless you have this data set ready, I do not feel that any genuine businessman is going to put money on you.
So I think what I've understood from your talk is that the startup owners, the youngsters, they need to focus more on the data as well as the problem solving ability.
Yes.
Rather than only focusing on funding. Part. Yeah?
Funding will come. If you have a strong idea, that will follow you. People reach out to us for funding, but we check. Like, let's suppose to build my products, I have almost put in nearly $2 million. I am telling you, my company has not raised even $1. We haven't. We didn't feel that is required because we had running cash. But same time, right now we feel because we try to make something big, so we will go. But at least we have a sales pipeline. We are not idle. But I'm saying that it is a good approach and it is not difficult. Like somebody told me yesterday that my son wants to do a business. He has some idea, but where do I get the capital? I said, why do you need capital? There's no business you need capital. I started my company almost like maybe it was from 1.5 lakh INR. That's what it all take. So right now maybe on my company I had made I don't know, maybe 3,000 times or 4,000 times bigger than that. And what we are going to claim, like I said, we are claiming a $250 million as a valuation this year. So I personally didn't feel, but still people have different challenges. I got the exposure, I got client, people may not get clients. So for that you need a team.
True.
And somebody rightly said you have to hire right candidates and you have to make those candidates work together, because right candidate will never work together. They will have their classes. So there are some opinion out there. Everything is out there. You have to just grab which suits you, which fits you. Then you can take it from there.
Wonderful, wonderful. Before we go for the rapid fire round, I would love to know that where and how you have developed this US accent. Because a lot of youngsters, they will be working in companies where they have to deal with US clients. So how?
My accent is not an US accent.
Okay.
Of course, like I'm working with the US clients from almost more than a decade now.
Yes.
So it's about the pronunciation. Let's suppose these all are the technicalities, right? So sometimes I tell people, like, if I am might be my crowd or Odia crowds are listening to me, so I can tell them this. Like, if we look at any Indian regional languages, let's suppose Odia, Sanskrit, Hindi, that. So if you look the numbers we have, like the letters we have, let's suppose with the punctuations, it is 52.
Okay.
Right? So English literature already has half of it, correct? So when it is half of it, the problem is we have a bigger data set. The permutation combination we can create, the you can say the sound we can produce is more authentic than it can be produced in the letters of US or English. I'm sorry, but the problem is it is their language, right? Let's suppose you are in Odia and somebody comes and pretend to say something in your language. Let's suppose a big statement. It will look funny.
True.
Though you will be okay, he's trying to talk my language, but it is funny. Anyways,
Correct.
so the same way when we talk to them, it becomes funny. So that I can give you some example how to rectify when you talk. Let's suppose it is N and T in the middle. It becomes double N. Right? Let's suppose we are talking about international. That is international. We talk international.
So
right?
T is silent.
Yes. Interview. It's not interview. It's interview.
Okay.
So like that, there are like lot of rules that takes on the accent. You do not have to do a tongue twist to create a fake accent. But if you talk, then everything will be good. Then it is available in YouTube. They can search. But maybe I have picked up the slangs from my US colleagues or
From the
people I work with, and I continuously work with them, talk 6-7 hours
So
a
eventually
day.
it has.
So that came along, but I can give you this mantra that it is there.
It's there.
If you follow the rules, the pronunciation will go pretty near to the US accent or whichever you are following up.
Okay, wonderful. Let's start rapid fire round. So the first question is, Samit, would you prefer picnics or outbound retreats for your employees?
Outbound retreats, of course.
Okay.
I will add up something because I'm on your show. Maybe by the time LTT was not registered, right? You were starting up. So I think you have been to my platform. You have given those outbound training, inbound training, and all those kind of things.
Yes.
That really helped a lot. Right? I have few people out there who never spoke, never interact, and after you came out, like I saw them mingling with everybody. They will initiate that.
Wonderful.
Okay, I will do this, that.
I'm so happy
that works. That works, and that program was fantastic. One of my director who already carry nearly 32 years of experience. You remember Rajesh,
Yes,
right?
yes, of course. How
So-
can I forget him?
Whenever he get a chance, he comes and say like, "Sir, thank you very much for that outbound retreat," and that was an eye opening for me. So I learned a lot of things from Arvind and Prince. So I thank you for that session.
Amlan was also there.
Amlan was also there.
Yes,
Yeah, thanks to him also. Yeah.
Thank you. Wonderful, means a lot. So the second one is one word which defines your leadership style.
I can say aggressive.
Aggressive.
One more I can say, resilience.
Resilience. Okay. So aggressive and resilient leadership style. Friends, it is not aggressive behavior, it's aggression in work. Yeah.
Right. So we have to get it done, and we have to have the team who can move mountains for us.
Yes.
That makes a difference.
Wonderful. Next is, if healthcare had a superhero, what would their power be like?
They can save life.
Okay.
They can diagnose exact disease. Yes, we are already working on it.
Okay.
So
Wonderful. Next, one business decision you are proud of today.
not diluting my equity, right?
Okay.
And declining some toxic partnership arrangements.
Okay.
So yeah, I think these two.
Wonderful. And last but not the least, late reports or delayed payments. What irritates you the most?
Late reports.
Late.
See, delayed payment, I am into a B2B segment. So sometimes that is an arrangement we have with our clients. Something that we have a runway, so client delays the payment by some few days or a week. We have the legal agreement, they will go for a late fee, that doesn't matter. They delay, I get more money. But when it is a delay in reporting, that is my internal culture. And when my internal team is not giving me reports proper time, I do not have the insight what I'm dealing with. I cannot answer the questions my clients are asking me. That frustrates me. It's not irritated, it is frustrating. So that's why I have picked right people who are very insightful. And then, as I told you, we have our own dashboard design for our clients. So we give all kind of complex matrices out there. They see, they take informed decision. So I see what my team is doing. So I will go with the report part.
Wonderful. Thank you so much, Samit, for your valuable and interesting insights. It really was wonderful.
Thank you very much for having me here.
Thank you.
Looking forward to it. Thank you.
Yes, thank you, Samit. So yes, we are wrapping up here, and it was an amazing interaction with Sambit. I mean, a lot of inputs were shared and a lot of practical insights were given by Sambit. And I'm pretty sure that those of you who are intending to get into this healthcare sector. I'm sure these insights are certainly going to help you. Now, if you are a student of ITR or you were a student of ITR some time back, so I would recommend all of you to please share this video in your circle, share this video with your ITR friends, seniors, juniors, teachers, okay, as much as possible. And if you are not from ITR, it's okay. If you really found this video interesting, do share it with your circle. Well, that's all from our end. Thank you so very much. This is Arvinda signing off from Lifecraft Training Academy, Crafting Lives.